we've looked at a lot of people have been looking close at this. All the new CDC numbers support this too, and it's like everything else in the United States. If you're non-white, it's going to be longer. So white kids tend to get diagnosed younger. Boys tend to get diagnosed younger than girls. So there is a disparity, a sex difference disparity in males versus females. If you're non-white, you tend to be diagnosed later. In terms of the ethnicities or racial beyond that, it kind of depends. And a lot of it has to do, there's a couple different factors. One is just access to care. So people in marginalized any group have more difficult access to care, so their diagnoses are going to be delayed. Another is cultural, not only like biases of the examiners, for example, for sex differences. We're more biased to see autism in males than females. And there could be a difference, a mismatch between like a white examiner and a black child. But there's also cultural differences in the culture they're coming from. So parents don't report the symptoms the same way either, it makes it more difficult too. So when you add those all together, that kind of creates the problem. The good news is if you look at the CDC numbers, we're getting better. So, we're diagnosed, it's not to the point of white kids, but non-white they're reducing the age of diagnosis because of they're paying more attention to access to care and cultural differences.